reducing and getting rid of acne scarring. Acne is a name that is famous in its own right, but for all of the wrong reasons. Most teenagers know, and dread, the very word, as it so prevalently wreaks havoc on their faces throughout their adolescent years. Few are spared from this onslaught, and, at some point or other in their lives, most of us have faced acne of some form or other. For some of us, fortunately enough, it subsides after adolescence. For others, it is a battle that they fight through their lives, to keep their acne under control. Still, even the luckiest of people who have a mildest case of acne rarely escape completely unscathed. And even after the acne is gone, it leaves behind signs that it was once there, most commonly in the form of scars. In many ways, it would be right to describe these scars as the final part of the battle against acne. Although some people choose to simply leave the scars be, completely happy that they're actually over and done with the acne itself, many others simply leave the scars be because they don't know what to do. Truth is, acne scars can be reduced, and even removed completely, which is generally the most preferred course of action. Needless to say, it is what this book is about: reducing, removing, and just plain getting rid of all those acne scars that are left on your skin. As far as how easy it will or will not be, well, that would depend on the extent of scarring that you're facing, and also on the type of scars. Soon enough, you'll see that not all scars are the same, and different types of scars often require different treatments. Before we get into the meat of things though, figuratively speaking, of course you should know that if you do have severe scarring, this is going to be a process that could take quite some time. But then again, if you do have severe scarring, you also no doubt have dreamed of being rid of it. With that kind of motivation, and the will to see things through till the end, you can and will be rid of your acne scarring. First though, let's take a look at what acne scarring actually entails. What is acne scarring? It might seem like a bit of a silly question to ask, but as you're about to see, it isn't really that silly at all. Although the common answer that would be given to this question is something along the lines of, well, it is scars that are left behind by acne, that doesn't really sufficiently answer the question at all. Why doesn't it? For the most part, it is because acne can leave more than just scars behind on your skin. Very often, this is the cause of a lot of confusion. Indeed, a lot of people term any and all things left behind by acne as acne scarring, which isn't really correct at all. No, acne scarring is just the actual scars, which contain scar tissue. With all that said and done though, we're going to also be taking a look at some of the other traces over the course of this book. After all, it does seem like a good idea to help you get rid of all the traces of acne, rather than just limiting ourselves because of a definition. Right now though, let's take a quick look at the type of acne scars that you might encounter. Hypertrophic scarring. If you have hypertrophic scars, then you will be able to recognize them instantly. In a nutshell, they're the type of scars that grow outwards. As far as appearance is concerned, they look like thickened skin in mild cases, but in more severe cases can even take the form of very large and thus very obvious growths that are a firm mass of tissue. Such scars are caused by an excess of collagen, and appear most often in acne has affected the torso. That said, this does not mean that it may not necessarily appear on facial acne as well. Men seem to be more susceptible to this type of scarring compared to women. Without a doubt, these type of scars, especially in the severe cases, should be dealt with, and they can cause a number of problems, not the least of which due to their appearance that often ties in with confidence and self-esteem issues. Let's now take a look at the other type of acne scars, which tend to be a bit more involved. Atrophic scarring. Unlike hypertrophic scarring, which causes tissue to actually grow, atrophic scarring is the complete opposite. It causes tissue to be lost. On the whole, it is much more common than hypertrophic scarring, and generally, Most of the acne scars that you would see in facial acne are various types of atrophic scarring. Matter of fact, there are 5 main types of such scars. 1. Depressed fibrotic scars. Generally speaking, this type of scars is large, though different cases of it can vary pretty considerably. Because of their size though, they affect whole patches of skin, and appear to be depressed valleys in the skin. By far, these scars tend to be the most severe looking, and often have steep and jagged edges. 2. Ice pick scars. Similar enough to depressed fibrotic scars, ice pick scars are sort of like a distant cousin to them, and a much smaller cousin to poo, generally appearing as a small hole rather than an entire depressed patch. No surprise then that this is where the name comes from, since their appearance strongly resembles skin that has been poked by an ice pick. At other times though, ice pick scars may even be slightly larger, and look more like an open hole or pore. Admittedly, most cases tend to be deep and narrow, as if an entire column of skin tissue has been destroyed, which is pretty much exactly what happens to form these scars. 3. Soft scars. As one of the more common types of acne scarring, soft scars are those small circular or boxy-type depressions in the skin. Basically it looks like a small pit in the surface of the skin. Though they are common, soft scars also tend to be the least worrisome, as they have gentle slopes, and merge with the surrounding skin. Incidentally, the name soft scars is used mostly due to the fact that they feel soft when touched. 4. Atrophic macules. Depending on how mild or severe these types of scars are, they are often mistaken for simple discolorations. When mild, that island technically, they are scars though, and when they first appear are normally purplish or bluish. At their base, there are normally small wrinkles in the skin that leads up to the scar itself. The cases of mistaken identity involving atrophic macules mostly stem from the fact that they aren't very obvious at times, and are mostly very small, especially in facial acne. 5. Follicular macular atrophy. Know what whiteheads look right? Well, follicular macular atrophy are a type of scars that pretty much look just like them. Normally, they crop up on the chest or back, instead of the face, and emerge as white lesions that are soft and do not protrude much from the surface of the skin itself. Oh yes, they essentially look like small whiteheads that didn't fully develop. Although they are scars, they are also a lot less permanent in nature than most other scars, and have been known to fade away after a few months, or years. That brings us to the end of our brief look at the types of atrophic scarring, which should have made you realize by now just how varied acne scarring in itself can be. And you know what? We haven't even touched on the things that aren't acne scars, but are often considered to be. Before we move on, we should definitely take a look at those spots and other traces left behind by acne. If you thought that the difference between spots and other traces is that, compared to scars, they're non-permanent, well, by now you should know better, considering we were just discussing the non-permanent follicular muscular atrophy. But it is part true, these non-scars are non-permanent, but they are just as visible. Two types of such spots and traces are particularly common among people who have acne, and they are, 1. Post-inflammatory pigmentation. Exactly as the name suggests, sometimes after, or even at the later stages of an inflammation, the skin of the affected area undergoes discoloration, or in other words, pigmentation changes. Normally, such a discoloration takes the form of the skin darkening in the affected area. Prevalently, this affects those who already had darker skin to begin with, though it is not unheard of that it would affect those with white skin as well. Eventually, they appear to fade away, but in some cases can stick around for quite some time. 2. Macules. Regular macules, as opposed to the atrophic variety, are simply red or reddish-brown spots that tend to appear in inflamed regions. They are the after effect of an acne lesion, and are normally pretty flat. Such spots can disappear completely, though it may take anything up to 6 or so months for them to do so. Clearly, One solution to these common acne traces is to simply leave them be and hope that they disappear, and to be completely honest, they do in most cases. However, sometimes they do need a little bit of a helping hand, and thankfully, the treatment for that mirrors the treatment for regular scars pretty closely. So, when we get to discussing those, we'll learn a bit more. For now though, we're going to be first taking a look at what causes these scars to appear. Causes of acne scars. Everyone knows that scars form when a wound tries to heal itself. But why is it that for some wounds scars seems to form, while for others they don't? What is it that's really going on to make scars appear on the surface of your skin? And, very importantly, why do the types of scars differ? These are the kinds of questions that are really pretty interesting, but unfortunately, the entire process of scarring is not exactly the easiest thing in the world to explain. Also, there is still a lot of guesswork concerning what exactly goes on. What is known is that when the body rushes to repair any wounds that it suffers as a result of acne lesions, sometimes things go wrong. Why things go wrong is not too clear, and some scientists think that it could possibly be genetic. When a flare-up causes lesions that are deep, that's when scarring is most likely to occur. Deep lesions mean that no matter how hard the body tries, it can't restore the skin to its original condition, and as a result, a scar is left. Basically, that is pretty much all that you need to know regarding the causes of scarring. In fact, the only reason we discussed it at all is so that you'd be able to look at the next section with more context. Preventing acne from causing scarring. True, scars can be dealt with, but it is so much easier if you never land yourself in a situation where you have to deal with extensive scarring. If you remember, way back at the very beginning of this book, we talked about how severe scarring could be a long and hard battle to fight. Well, now we're going to take a look at how you could avoid putting yourself in that situation. Of course, no matter how hard you try, if you have acne you probably will end up with a few scars, unless your acne was really very, very mild. But the trick is to do everything possible so that you minimize the amount of scars and their severity. That way, you're going to be less likely to end up with extensive and severe scars that will take a long time to deal with. Right, so you know why it is important. So what is it that you actually need to do to minimize the risk of scarring and amount as well as severity of scars in general? Don't scratch, squeeze, or pick at lesions or scabs. Makes sense, right? True, it's pretty basic, but so many of us actually go wrong on this and end up picking at our scabs and lesions. In fact, it used to be a popularly held belief that popping the whitehead would help it heal faster. Needless to say, this is completely wrong, and quite to the contrary. Popping a whitehead will most likely extend the healing time required, as well as damage the skin around it. Also, the very action of squeezing could push whatever is clogging your pores and causing the whitehead deeper into the skin. In turn, this would cause the whitehead to just re-emerge, and probably grow in size. Infection can also spread as a result. When you do have any lesions or scabs on healing lesions, just leave them be as much as possible. Try to even avoid washing the area roughly. If you can't keep yourself from scratching, squeezing, or picking at your scabs and lesions, you'll find that the amount and severity of the scars that you do end up with are much, much lesser than otherwise. Treat acne fast. Another fairly simple way to limit scars is to actually get your acne itself under control as quickly as possible. Unfortunately, most people tend to wait until their acne is pretty bad before they visit a doctor or seek any kind of treatment. While it is an understandable impulse to want to see if it will get better or subside by itself, this means that if or when it gets worse, you need to start treatment from scratch. And by the time you get your acne under control, it will probably already have left numerous lesions that will eventually become scars on your skin. On the flip side, if you do get treatment early on, you'll probably have an easier time getting your acne under control as it won't be so widespread. If you can't do that, then chances are there won't be many lesions that will end up scarring. Simple enough, right? Well, remember it. Keep skin generally healthy. What does this have to do with scarring? More than you might imagine. If your skin is generally healthy, when it suffers wounds such as those caused by acne lesions, it will be in a much better position to heal itself. Of course, this doesn't mean that you'll be completely immune to the prospect of scarring, but it does reduce your risks. To do so isn't difficult really. Some of the common ways to keep your skin health are really mostly the kind of things that you should be doing anyway. Eating a balanced diet, drinking a lot of water, protecting your skin from the sun's harmful ultraviolet rays, and even just not smoking. Of course, if you already have skin problems, such as constantly dry skin, you might want to use moisturizers, or seek some other ways of dealing with it. Anything and everything that promotes the well-being of your skin is good. With these 3 fairly ordinary steps, you could be able to reduce the risk of your acne causing extensive scarring. Since you know just how worthwhile that is already, we're not going to reiterate it. But what we are about to deal with are the ways in which you can treat scars that have already formed, in order to reduce and remove them. While we do, you'll no doubt gain a better understanding of just how involved a process this could be. So here it is, treating existing acne scars. How about a quick recap before we begin? Now, you know what acne scars are, as well as the types of scars can possibly form. On top of that, you also know a little bit about the known causes of scarring and how it is possible to prevent it from happening. Great, but as we've also stated, when you have acne flare UPS, unless they're very, very mild, chances are you're going to end up with a few scars anyway. Or maybe even pretty extensive scars. It really can vary from person to person. But the important thing is still that no matter how severe your scars are, there are options that you can pursue in order to reduce them, and maybe even remove them completely. Granted, the more severe your scars are, the harder it will be, but it is still possible. Pretty much all of these treatments will need you to visit a dermatologist before you can carry them out. In fact, most of them will need to be carried out by the dermatologist himself, or a similarly trained specialist, as you'll soon see. So while we're going to give you the lowdown on the type of options that you should consider, at the end of the day, you will need to get an expert to help you out. Anyway, let's begin to discover how it is possible for you to get rid of your acne scars and restore your skin to its original beauty. Dermabrasion. One of the most popular ways to remove scars, or any spots in general, dermabrasion is very popular, and has evolved over the years. Originally, undergoing dermabrasion meant, quite literally, sanding some of the topmost layers of skin off of the affected area. Not with sandpaper or anything like that, of course, but with a special surgical tool. What this tool amounted to was normally a high-speed brush, which would produce the sanding effect. If you think that it sounds painful, well, you aren't wrong. Honestly speaking, it is a very painful procedure, which is why using some form of anesthetic is a must while you undergo treatment of this kind. Normally, the normal general anesthetic which knocks you out completely is used, but some do opt for twilight anesthetic in which you are part conscious instead. Either way, you should discuss it with your dermatologist. Well, you might be wondering just how removing the top few layers of skin will help you with your scars. Essentially, the idea upon which dermabrasion operates is the fact that by removing the few layers of skin, the scar can be lessened or sanded off gradually. Then, with time, new skin can grow over it to be smooth and more normal. Because of this, dermabrasion is most effective on scars that protrude outwards, and in sunken scars, or rather, atrophic scars, it is not so useful. For some cases, especially with ice-pick scars, dermabrasion may actually invariably reveal a much bigger hole after the first few layers of skin are taken off. Still, it remains a very effective method of getting rid of scars, and any other spots in general. Nowadays, the traditional sander-type surgical tool that was used for a long time has actually been replaced by more advanced technology. So dermabrasion can now be carried out using the carbon dioxide or erbium colloidal laser compared to the more traditional method that would leave skin raw and bleeding. Dermabrasion that uses a laser is much more precise, and thus very rarely causes any bleeding at all. Again, it is something that you should definitely ask your dermatologist about if you're interested in undergoing this procedure. Note: anyone with dark skin should be aware that dermabrasion may cause pigmentation changes in the areas in which it is used. Microdermabrasion, as you probably guessed, microdermabrasion shares quite a bit in common with the dermabrasion that we were just discussing. In fact, it is based on the same principle. So basically, once again, the top few layers of skin are removed, and by doing so, scars are lessened or removed completely. Incidentally, as it is based on the same concept as dermabrasion, it shares the same weakness. It too does not deal with sunken scars very well. But that is where the similarities between microdermabrasion and dermabrasion end. Unlike dermabrasion, which is a painful and invasive procedure, microdermabrasion is mild by comparison and not invasive at all. It doesn't even require the usage of anesthetic, which should tell you something about just how mild it is. When microdermabrasion first started being used, it relied on the usage of tiny crystals that would be blasted onto the skin to remove the top layers of the skin. While this worked wonderfully, gradually more alternatives began to be developed. One of the more popular alternatives in use today are the home microdermabrasion systems. These are now sold in kits that basically provide the same type of result as crystal microdermabrasion, but are slightly less effective. Also, instead of crystal, most of these home kits use other types of particles. There are many different types of these kits out there, but your dermatologist should be able to recommend one that suits your skin type. Do not try to just buy a kit and start self-treatment without advice from a medical expert though, as it could lead to complications. In the area of professional conducted microdermabrasion, there have been some advances too. Although crystals are still widely used, a new method of microdermabrasion involving using a diamond-tipped device to abrade the skin is now used. Generally, both crystal microdermabrasion and diamond microdermabrasion are similarly effective. Due to the fact that microdermabrasion is gentler than dermabrasion, its results are also slightly less effective. So where a single dermabrasion procedure might suffice for some scars, with microdermabrasion it might take 2 or 3 treatments. Thus, microdermabrasion is a very nice alternative to dermabrasion, but in cases involving severe scarring, it might be best to just stick to dermabrasion itself. Subcision. Seeing as we've covered 2 procedures that deal primarily with protruding scars, it probably is time we got to one that can take care of depressed scars, and that would be subcision. As a surgical procedure, it is one that is fairly involved, but it basically consists of using the needle to sever the layers of tissue between the scar and the skin. When that is accomplished, blood will rush into the affected area and fill it up. For deep depressed or sunken scars, this can even out the skin. Even if, after healing, a scar has reformed on the surface of the skin, it can then be treated through either microdermabrasion, or a number of other methods which we'll be discussing soon. Basically, subcision allows sunken scars to be corrected and then subsequently treated more easily, if necessary. Of course, it will take time for the subcision area to heal, and sometimes there could be some small bruising that will need to heal too. At the end of the day though, the results of subcision speak for themselves. Collagen injections. Yet another procedure that deals with sunken or depressed scars. Collagen injections are, unfortunately, a rather temporary measure. When collagen is injected into a deep scar, it can even it out by filling it up. Therefore, once the injection is carried out, the affected area should appear a lot smoother, and more like it did before the scar. However, collagen itself is non-permanent, and so the process would need to be repeated every 3 to 6 months for as long as you want to sustain it. If you're willing to commit to that, great. Before you firmly decide on collagen injections though, you should definitely check if you have any autoimmune diseases or allergies. Most collagen used is bovine sourced from a cow, so if you're allergic to anything like that, you'll need to specifically use human collagen instead. Similarly, if you have any autoimmune disease, you should never use any animal-sourced collagen. All said and done, it is a rather nice solution, but the temporary nature of it would make most people think that it isn't worthwhile. Laser resurfacing. Remember how lasers are currently being used in dermabrasion? Well, apart from that, there are also various other forms of usage for lasers in helping to remove acne scars, and one of those is known as laser resurfacing, or sometimes fractal laser resurfacing. By wounding the skin using the laser, the molecular bonds themselves are targeted. Getting into an in-depth analysis of how exactly laser resurfacing works is a bit out of our league right now, but what is more easily explained are the results that follow. These results are twofold. First, damaged skin cells, no matter how deeply embedded they are, can be destroyed. Second, the growth of collagen can actually be stimulated within your very skin. At first glance this is unremarkable. We just discussed collagen injections after all, and isn't growing new collagen pretty much the same thing? As a matter of fact, it isn't. Because your own body is growing this new collagen, the effects are not temporary, unlike collagen injections. So as the new collagen grows and lifts the surface of the affected area, it fills out any previously sunken scars. While this process is going on, and it normally takes about 4 months for the collagen stimulation to run its course, you'll notice a dramatic improvement in your acne scars. Not only will your skin be more even, but the scarred appearance should have been taken care of by the laser as well. Sounds too good to be true, doesn't it? Well, although it certainly is true, it does have its downsides. Laser resurfacing can be a pretty large bill to foot, and if your insurance doesn't cover it, this could be an issue. On top of that, if you have some pretty deep acne scars, it may take more than one treatment before enough collagen is stimulated to even them out completely. With each treatment racking up a substantial bill, this only compounds the problem. Still, laser resurfacing is a great way to get rid of acne scars, so if you're really intent on waving goodbye to any and all scars you might have, it is worth pursuing it. Start off by consulting your dermatologist, and finding out if your insurance covers it. If it does, then you could be well on your way to ridding yourself of acne scars. Chemical peels. Heard of these before? They really are one of the more common types of treatments, so you probably may have. Regardless, chemical peels work on what might initially seem to be a very bizarre basis. Certain chemicals are used in the process, and applied directly to the skin. While that isn't really too bizarre, the result certainly is. For all intents and purposes, the aim of applying these chemicals is to get the skin to blister. But aren't blisters bad? You might ask. Well, yes. In most cases blisters are generally bad, and intentionally wanting to cause blisters is really quite strange. However, the blisters are being provoked for a reason. If you think back to any blisters you might have, and then think about what eventually happens to blisters, you might even guess it yourself. Basically, eventually after the skin blisters up, it will start to peel. And that is where the name chemical peel comes from. This peeling of the skin is basically what you're aiming for with any chemical peel. Reason being, once your skin is peeled, it will expose a new layer of skin beneath it, which will regenerate. It is this regenerated skin that is the desired final result. Not only is the new skin smoother, but it also lacks most of the marks, spots, and even scars that the old skin might have had. Of course, using chemical peels to treat deep, sunken scars, or large outgrowths is pretty much impossible. Instead, chemical peels are more intended for the smaller, less obtrusive scars. Being cheaper than most other forms of treatment, in general, it is a very nice alternative. In order to get a chemical peel, you should consult a dermatologist. While it is true that some chemical peels need not be carried out by a medical professional, it would be risky to just splash chemicals onto your skin without getting an expert opinion. Currently, there are many types of chemicals that are used in chemical peels, and, naturally, the dermatologist would be in the best position to advise you on which one you should be using. Typically though, the type of chemical peel that is most commonly and widely associated with acne scar removal is alpha-hydroxy acid AHA peels. Punch excision. Sometimes, scars can be tackled with a more heads-first approach, and none epitomizes that better than punch excision. How it works is ridiculously simple. The surgical tool, known as a punch biopsy tool, pretty much just excises the scar itself. Yes, that does mean that it basically is used to cut it out entirely from the skin. Once the scar is very physically removed, the edges of the skin in the newly formed wound are sutured together or glued together using a special skin glue and left to heal. In most cases, either the skin will heal perfectly, or, even if a scar does form, it will be much smaller than previously. Obviously, this type of technique is not intended for large scars, but works best on ice-pick scars. Added to this, there are a couple of other variations to the technique that have been known to produce even better results. The two most common of these are known as punch elevation and punch excision with skin graft replacement. Both operate on roughly the same philosophy, that is, instead of just leaving the skin to heal, and risking another scar appearing, the excised part is actually replaced by something else. In the case of punch excision with skin graft replacement, well, it is a skin graft that is used. Unfortunately, this has proven to be slightly problematic, as the skin graft may not have the same color and texture as the skin around it, even once healed. Keeping that in mind, punch elevation seeks to correct the shortcoming of skin grafts by only excising the base of the scar, while leaving its walls alone. Following this, that very same base that was excised is elevated to the skin's surface, and sutured on. By doing this, the color and texture of the skin has a much greater chance of being identical. At the same time, the advantage of reducing the risk of another scar appearing is also just as present as with skin grafts. Autologous fat transfer. Last, but certainly not least in the list of acne scar removal treatments that we're discussing, is autologous fat transfer. Yes, the name really does describe it quite well, and it is the transfer of fat from one part of your body to another. By extracting fat from any other part of your body, and then preparing it into an injection, you could use this technique to fill out any depressions of sunken scars. Basically, it is fairly similar to the collagen injections which we discussed earlier, but this time it is your own fat that is being used. And it tends to last longer than collagen, though the exact period does depend on the rate at which your body reabsorbs fat. Frankly speaking, that could be anything from 6 to 18 months. Strictly temporary, it still is an avenue that is worth pursuing if you don't want to go for the much more expensive solution of laser resurfacing. Repeating the process every so often would be necessary though, if you want to maintain the results. Final words on scar removal treatments. Now that you know most of the treatment options, you should have a rough idea of which one would apply to you best. And you also probably realize that removing and reducing your scars is far from a walk in the park, and can actually sometimes be a painful, literally, process, depending on the treatment that you choose. So yes, once again, prevention is definitely the better option, but no matter how hard you try, if you end up with a severe case of acne, you're bound to get the scars that come along with it. When that happens, then your only recourse is to fall back on one of the options that we were just discussing. It isn't any reason to give up though, all that it means is that you'll have to fight slightly harder to rid yourself of the last few remnants of acne. If you want further help, advice, or even just wish to start on a treatment, then, as you probably already know, your first port of call should be your dermatologist. Mention the treatment that you're interested in, and get his or her opinion on it. Then, raise any questions regarding alternative recommendations that might be worth considering as well. When all said and done, making sure that you choose exactly the right procedure for yourself is going to be very important. Especially seeing as some of the scar removal treatments are of the ongoing variety and could take months, or even years, for you to see through to the finish. Once you do start on something, however, keep to it, unless it very obviously isn't working. Before we end our discussion on how you can reduce and remove your acne scars, let's go over the cliff notes, just to be absolutely certain that you know everything that you should know. Everything about dealing with acne scars. Well, no one knows everything, but what you do know at this point should come pretty close to everything. Over the course of this book, we've taken a look on what exactly acne scars are, and discussed the various types of scars that you could end up facing. While we were at it, we also glanced at some other marks and traces left behind by acne that are commonly confused with acne scars. Moving on, we had a short overview of the causes of acne scars, and then quickly progressed into discussing how it would be possible to prevent acne scars from ever forming. And we stressed, and then re-stressed on how much hassle you could avoid if you managed to decrease your risks of acne causing severe scarring. Finally though, we went into the options as far as the treatment of existing scars was concerned. Which brings us here, to the end. If during that overview you were unsure of any parts, then it would be advisable to go back and reread them. All of it really forms the core knowledge that you'll need if you want to deal with your acne scars. All that remains is for you to act on what you've learned, and start working towards the day when you'll be able to look in the mirror and see your skin absolutely scar-free.